Bonjour, je suis ici avec mon mari au Clinical Center.
Namaste, मेरा नाम अशोक कुलकर्णी है.
Sí, a mí me encanta el Clinical Center, es el lugar tan variado.
Ich komme aus Deutschland, arbeite hier am Clinical Center und liebe meine Arbeit.
中国大陆来很高兴能有机会在 NIH
بزيك Clinical Center دولتنا متعسة إن شاء الله.
و در Clinical Center کار میکنم و اینجا رو خیلی دوست دارم.
NIH is a federal agency committed to advancing scientific and medical research. It is important as a clinical center staff member that you become aware of the needs and appropriate practices regarding the care of patients who speak languages other than English.
Today you were having pain.
Communication between patients and staff is central to quality medical care. The onus of communication with patients who speak languages other than English is not on the patients, it's on us. Within the social work department, there are resources available to help with this communication when language is a barrier.
The social work department is responsible for the language interpreters program at the clinical center, and we provide interpreting services for our patients and family members who need assistance with interpreting.
The Language Interpreters Program has a cadre of paid interpreters, in-house and community volunteers, and student interns who together speak over 60 different languages. Also, remote interpretation services are available at any time.
Because even in the middle of the night, when they do have to call, they call the service, they have someone there. So there is no problem, no barrier.
Good morning, social work.
To request an interpreter, contact the social work department during business hours.
When you make a request, I need the patient's name, the protocol number, date and time and location, the length of time, and the procedures that's being done. This is important to us because we need to know which interpreter to match with which request.
Proximate or in-person interpretation is a limited resource in the clinical center, so it's advisable to have flexibility when scheduling. All requests, changes, or cancellations should be made in advance. This will help maximize the available resources.
It causes problems for us when the request is canceled or the request is given at the last minute and we have to find someone to complete the request.
English proficiency varies greatly. Those who need language assistance may speak English but may not be comfortable using English in a medical setting.
It might appear that they actually understand what you're saying, but it might not be true. It might also be a stressful situation, or they might not know the medical terminology necessary to understand what you're explaining to them.
Although the interpreter is not an expert in culture, he or she is aware of cultural differences that can affect the delivery of health care. The interpreter can serve to help bridge the cultures of patients and staff.
We have many different cultures in our building, and when they participate as an interpreter, I think they're lending more to the value of recognizing differences in culture.
Friends and relatives should not be used as interpreters.
Technical issues and confidentiality are my main concerns with using family members or friends as interpreters.
There is an emotional involvement. It may affect me. Besides, I'm not that knowledgeable. I'm not a doctor, I'm not a nurse. Even if I were, the emotional factor is going to be there. Relatives are here more for moral support. We're here because they want to have family. But as far as the treatment and as far as what they're getting done, they do need someone to interpret for them.
The Language Interpreters Program has created a multilingual brochure that explains the available services. It includes a card which patients can use to indicate their language.
Oh, Spanish. Un momento.
To maintain the natural flow of information during interpretation, be as straightforward as possible. Avoid slang and images that may not translate well across cultures, and pause after each idea.
Even if patients are coming from within this country, there are so many languages that people speak exclusive of English. And to communicate with them, you need to have an accurate and confident interpreter who is well versed in technical language. So it's essential, I think. For the work we do, it's absolutely essential.
Interpreters do not interpret word for word. They interpret rather meaning by meaning. And sometimes that can render the interpretation longer or shorter than the original. It doesn't mean that something is being omitted or something is being added. It is just that in different languages, it might take longer or shorter to convey the same meaning than another language.
What I try and do is still speak to the patient, even though you're speaking through an interpreter, to maintain eye contact with the patient, even though they don't understand the word of what you're saying.
When using an interpreter, it is best to speak directly to the patient, look the patient in the eye, rather than turning around and asking the interpreter, can you ask her how she feels? This way you establish more of a rapport and more of a connection with the patient when trying to communicate with them.
Translation is conveying a written message into another language in written form.
Hi, how are you today?
Interpretation is conveying an oral message into another language in spoken form. Short documents such as a discharge plan, medicine instructions, or short notes can be translated by our interpreters. However, longer documents can be sent to the NIH library for translation. When you receive or need to make a call to or from a patient whose main language is not English, you can use the telephone interpretation services. You'd be surprised how helpful it is to learn a few phrases in the most common languages that you work with.
Je cherche un interprète.
Many of the interpreters at the Clinical Center are volunteers, and they are a valuable part of the overall research efforts.
We really need a language interpreters program because we are in the business of providing excellent care to our patients and families. And the only way we can do that is by good communication.
I think we're lucky here that most of the interpreters that we use have done this for quite some time, and so they are actually quite a bit of a help.
The flavor of NIH is just, I think, just so invigorating. When you walk down the corridors and you hear all the different languages, I'm so attuned to it now, you realize the cultural value that you have at hand.
There is no such thing as a language that is less sophisticated or more sophisticated or more advanced or less advanced than another language.
As good healthcare providers, we're all responsible for providing good communication with our patients and families.
The NIH has patients from all over the world. They come here for an expert opinion, and if you cannot communicate with them, there's almost no point in them coming.
NIH is committed to a patient-centered research environment where the best possible health care is delivered regardless of language and cultural background. Welcome to the wonderfully diverse world of NIH.